How to manage discomfort after a polypectomy procedure. If you've recently had a polypectomy, you might be wondering how to handle any discomfort that comes afterward. The good news is that most people experience only mild symptoms that can be easily managed with proper care. Right after the procedure, it is common to feel some mild cramping, bloating, or light bleeding for a few days. These symptoms usually last 1 to 3 days and tend to improve as your body heals. You might also feel a bit tired, but that should pass quickly. For pain relief, over-the-counter medications like acetaminophen are generally recommended. It's best to avoid non-steroidal anti-inflammatory drugs such as aspirin or ibuprofen, initially because they can increase the risk of bleeding. If you notice your pain becoming more severe or lasting longer than a couple of days, it's important to contact your healthcare provider for guidance. Diet plays a role in comfort and healing. Stick to light, easily digestible foods and stay well hydrated. Avoid foods and drinks that can irritate your digestive system, such as caffeine, alcohol, spicy foods, and soda for the first few days. This can help reduce bloating and discomfort. It's also wise to limit physical activity during the initial recovery period. Rest is important, but gentle walking can be beneficial to promote circulation and reduce bloating. Avoid strenuous activities, heavy lifting, or vigorous exercise for at least 1 to 2 weeks, depending on your doctor's advice. Monitoring for signs of complications is crucial. Seek medical attention immediately if you experience heavy or persistent rectal bleeding, especially if you pass blood clots or maroon-colored stool. Severe abdominal pain that doesn't improve after passing gas or a bowel movement should also be evaluated. Fever over 100.4 degrees Fahrenheit, chills, dizziness, fainting, or signs of infection like redness, swelling, or pus at the site are warning signs. Although rare, complications such as bleeding or infection can occur, so prompt medical attention is essential. Follow-up care is important for complete healing. Attend all scheduled appointments, including any repeat colonoscopies recommended by your doctor. These visits help ensure that the site heals properly and that no new polyps develop. Additional tips include avoiding driving for 24 hours after the procedure if sedation was used, and checking with your doctor about resuming your normal medications. If the polypectomy involved the cervix or uterus, avoid sexual intercourse and tampon use for 1 to 2 weeks to prevent irritation or infection. In summary, managing discomfort after a polypectomy involves taking mild pain relievers like acetaminophen, avoiding NSAIDs initially, resting, eating gentle foods, staying hydrated, and watching for any signs of complications. Always communicate with your healthcare provider if symptoms worsen or if you notice any concerning signs. Following these steps helps support your recovery, promotes colon health, and reduces the risk of complications. Remember, each person's experience can vary, so personalized medical advice from your doctor is always the best course of action.